Today, we assume that before a drug reaches a pharmacy shelf, it has survived rigorous trials, cells, animals, multiple phases of human testing, surveillance, oversight. In the 1950s, that world barely existed. In West Germany, there was no independent federal body requiring deep testing before marketing. A company largely registered a product and submitted its own data. There was no requirement to test for birth defects, no mandate to examine pregnancy risk. The UK wasn't much better. Before the early 1960s, centralized licensing systems were weak, and industry culture leaned on a gentleman's agreement. If a drug didn't immediately poison adults, it often passed. The United States was somewhat stricter, but still deeply flawed. The 1938 Food, Drug, and Cosmetic Act required companies to show safety, but the system included a ticking clock. If the FDA didn't object within a certain time window, approval could effectively proceed. And underneath all of this sat one of the most dangerous medical assumptions of the era, that the placenta was a perfect barrier. Textbooks taught that the fetus was protected, sealed off from whatever the mother swallowed. We now know that is tragically wrong. But because this belief was widespread, no one thought pregnancy testing mattered. Why test on pregnant animals if the baby is insulated anyway? And even worse, Grunenthal's animal tests relied heavily on rats, a species that, by biological quirk, is relatively resistant to thalidomide's signature birth defect mechanism. So you had a perfect storm, a scientific blind spot about the placenta, a lax regulatory system, wrong test models, and a culture obsessed with miracle cures. Thalidomide didn't sneak through cracks. It drove through a hole no one realized existed. And by the time the world noticed, millions of women had already taken it. By late 1960, the miracle was already over, even if the public didn't know it yet. Inside pediatric wards across Germany, doctors noticed something terrifying. Defects that should appear once in a career were appearing repeatedly. Dr. Hans Rudolf Wiedemann, a pediatrician in Krefeld, described a sudden spike in rare, specific defects. He didn't know the cause, but he knew it wasn't random. He called it an epidemic. The term phocomelia may sound clinical, sterile, like it creates distance, but it doesn't capture what parents saw. Imagine a family in a town near Hamburg, a normal pregnancy, a doctor-prescribed safe pill during early nausea. Labor begins with ordinary joy. Then the room falls silent. Midwives hesitate. The baby is wrapped tightly, swaddled to the chin, an act of mercy or cowardice. And when the blanket finally moves, the truth hits. Hands attached close to the shoulders, arms missing, legs twisted. For thousands of families, that was the moment their lives fractured. And it wasn't only limbs. Thalidomide attacked developing tissue everywhere. Malformed ears, deafness, facial nerve paralysis. And the most lethal damage was invisible. Hearts, kidneys, digestive systems. The famous 10,000 affected children is a survivor count. It excludes miscarriages, stillbirths, and infants who died quickly. For months, the medical world blamed everything except the pill. Radiation from nuclear tests, a virus, detergents, even, horrifyingly, some blamed mothers, suggesting they had attempted abortions. The culprit sat in the medicine cabinet next to toothpaste. But because thalidomide was believed non-toxic, it was one of the last suspects. One breakthrough came from Sydney. Dr. William McBride, an obstetrician at Crown Street Women's Hospital, noticed a cluster, babies born with rare limb defects and internal obstructions. He checked what the mothers had been given. A common denominator appeared: Distavol, thalidomide. He stopped prescribing it immediately. He warned the company. He was brushed off. So he wrote to The Lancet. Published December 16, 1961, his message was calm but devastating. The rate of severe abnormalities among mothers given the drug was wildly above normal expectations. Meanwhile, in Germany, another doctor moved like a detective. Dr. Wiedekind Lenz in Hamburg, the epicenter. He went door to door, asked mothers what they ate, where they went, what they took. At first, women didn't mention Contergan. Why would they? It was as routine as aspirin. But when Lenz asked specifically about sedatives and sleeping pills, the pattern snapped into place. Every mother of an affected child had taken thalidomide early in pregnancy, during a narrow developmental window. Lenz phoned Grunenthal's research director and said the unthinkable: "Your wonder drug is maiming children." The reaction wasn't urgency. It was denial. And, according to accounts, pressure, legal threats, delay, stalling. Then the story broke into public view. On November 26, 1961, a German newspaper ran a bombshell, harmful to the unborn. Panic surged. The next day, November 27th, Contergan was withdrawn from the West German market. In the UK, withdrawal followed shortly after. But in those crucial weeks, more pills were sold. And for babies already exposed, the damage was already done. While Europe woke into a nightmare, the United States stood at the edge of its own cliff. A company acquired American rights to thalidomide and rebranded it as Kevidon. They expected quick approval. Millions of tablets were prepared, ready to ship. In September 1960, the application arrived at the FDA, and it landed on the desk of Dr. Francis Oldham Kelsey. New to the agency, yes, but not new to science. Kelsey wasn't impressed by testimonials. She wanted data. And what bothered her most was what was missing. The application leaned on one big claim: rats didn't die. But Kelsey noticed something else. The drug didn't even make rats sleep. If animals reacted so differently, how could safety conclusions transfer? She also noticed reports of tingling and nerve inflammation in adults. If it could damage nerves, what else could it damage? So she did something simple and courageous. She refused to approve it. The company pressured the FDA, called her obstructive, tried to go around her, but every time the regulatory clock neared completion, Kelsey demanded more evidence, sent the application back, reset the timer. She held the line. Yet, the story has a darker detail. While Kelsey held the front door, the company distributed thalidomide under an investigational use loophole, millions of tablets to doctors, including for pregnant women. When Europe's catastrophe became public, the U.S. avoided mass disaster, but not entirely. A small number of American cases are confirmed, with estimates varying. Each one was a tragedy that should never have happened. Kelsey became a national figure, and the scandal forced reform. The Kefauver-Harris Amendments, 1962, fundamentally changed drug regulation in the U.S., requiring proof of efficacy, tighter safety standards, and modern clinical trial frameworks. By the late 1960s, shock became fury. In West Germany, a major trial began against Cheme Grunenthal officials, accused of negligence leading to deaths and injuries. It looked like it would be definitive, but real-world justice is rarely clean. The trial dragged on, years, and then it ended without a verdict. Charges were dropped under a legal mechanism, and a compensation foundation was established. Families received financial support, needed for surgeries, prosthetics, lifelong care. But many did not feel they received justice. The people who put the drug into the world largely kept their freedom. In the UK, the fight took a different shape: civil pressure and public outrage. Distillers, the company that sold the drug as Distaval, faced years of resistance and negotiation. Media pressure became a tool. Settlements eventually created long-term support structures, but it took years of grinding conflict. It's easy to picture thalidomide as a black-and-white photograph, a baby in a specialized chair. But that baby grew up.
Today, survivors are in their 60s and 70s, and the crisis hasn't ended. It has changed shape. Many survivors spent decades adapting, using feet to write, cook, drive, type, forcing shoulders and spines to do the work arms were meant to do. Human bodies are adaptable, but they are not indestructible. Now comes accelerated wear, arthritis, nerve compression, spine degeneration, collapsed joints. With decline comes a terrifying loss of independence. People who fought for autonomy, jobs, families, normal life, face dependence again. Compensation systems designed for children didn't anticipate the massive cost of aging with complex physical realities. Survivors in multiple countries have had to return to the negotiating table again and again. And the psychological weight is immense. Many were cared for by parents for decades, parents who are now gone. The fear of institutional care that isn't designed for their bodies is constant. Thalidomide didn't only take limbs. It demanded payment every single day for a lifetime. If this were a movie, the story ends with reform, accountability, and closure. But this isn't a movie. The monster didn't die. It moved. In parts of the world, thalidomide remained in use because of its effectiveness in treating certain inflammatory complications of leprosy. Controls existed on paper. In practice, poverty, weak systems, medicine-sharing culture, and inequality made enforcement difficult. A new generation of children was born with familiar defects, decades after the original scandal. A drug from the age of the typewriter, injuring children in the age of smartphones. The brutal lesson: as long as the drug exists, and as long as deep inequality exists, risk never truly becomes zero. So why does thalidomide exist at all? Because the same mechanism that makes it devastating in embryos also makes it powerful in certain diseases. Thalidomide's anti-inflammatory properties became useful in specific medical contexts, and its anti-angiogenic effect, starving blood supply, became relevant in cancer therapy. In 1998, the FDA approved thalidomide under strict controls. Not casually, not lightly. It came wrapped in the most intense safety system imaginable. Registries, verification, pregnancy testing, contraception requirements, warning labels. Because thalidomide is not just another drug. It is a weapon that has to be locked in a safe.
On paper, thalidomide was the big bang of modern drug regulation. It reshaped trials, consent, surveillance, warning labels. But laws are only as strong as the culture enforcing them. And the culture that minimizes patient risk, especially risks to women, didn't vanish overnight. Other drug scandals have echoed the same themes: risks downplayed, warnings delayed, patients dismissed. Thalidomide's ghost lives on every time someone says completely safe. Because medicine isn't magic, it's power. And when we confuse the two, the most vulnerable pay the price. You might think after 60+ years, the legal battles are finished. They aren't. Thalidomide remains in court. In recent U.S. litigation connected to thalidomide birth defect claims, a federal judge in Philadelphia referred a prominent plaintiff's firm, Hagens Berman, and its managing partner, Steve Berman, to the U.S. Department of Justice for investigation after findings from a court-appointed special master raised serious allegations about litigation conduct. The firm has denied wrongdoing, and these matters are allegations, not convictions. But the grim reality remains. For survivors, the fight for recognition and resolution is still entangled in systems that rarely deliver clean closure. Thalidomide was sold as a lifestyle accessory, a gentle helper for modern stress. Instead, it targeted the most vulnerable humans imaginable, embryos, within a window measured in days. It exposed the arrogance of mid-century medicine. It shattered the illusion that doctor prescribed automatically means safe.
It proved that non-toxic in a rat does not mean harmless in a human. For survivors, this history isn't a chapter. It's daily reality. 6 decades of adaptation, 6 decades of struggle, and now the added burden of aging in bodies compromised before birth. Thalidomide did change the world. It forced modern regulation into existence. It taught medicine humility. But the real lesson isn't just about molecules or agencies. It's about a phrase we should fear whenever it appears in advertising or reassurance: completely safe. Because whenever profit outruns caution, whenever systems stop listening to patients, the door opens for the next disaster. Thalidomide is a life-saving drug in specific contexts today, but it sits behind layers of regulation for a reason. That is exactly where it belongs.
Thank you so much for watching. If you like this video, feel free to share, like, and subscribe.